Hi all, welcome back to my channel. I hope you guys are doing good. Today I am going to discuss about placement of ECG leads. Let's move on to the topic. ECG, electrocardiogram. As you all know that an electrocardiogram is a test that records the electrical activity of your heart. It is done by an ECG machine that records the rate, rhythm and electrical activity of the heart. Let's see about an ECG electrodes and leads. In order to obtain 12 lead ECG, we need 10 ECG electrodes. ECG electrodes are small plastic patches that stick to the skin. Then they are connected to an ECG machine by lead wires. In the picture, you can clearly see the white small patches which is known as ECG electrodes, and they are connected to the ECG machine by lead wires. Before moving on to the placement of an ECG leads, let's have a look at the basic landmarks of chest. First one is clavicle. This is also known as collarbone. It is a thin bone that runs from your sternum to your shoulder blade. Second one is sternum. The sternum is a T-shaped vertical bone that forms the anterior portion of the chest wall centrally. Next one is ribs. There are 12 pairs of ribs which surrounds the lung and the heart and supporting the breathing process. The last one is intercostal space, that is the space located between the ribs. Here is an ECG machine with 10 leads. Each lead is clearly labeled as V1, V2, V3 and so on, which aids in proper placement. Here you can see the placement of ECG leads. Right arm, right leg, left leg. And in the second picture, the placement of V1, V2, V3, V4, V5 and V6 leads. Let's see the placement of ECG leads in detail. As I said, each lead is clearly labeled. So the lead which is labeled as RA can be attached anywhere between the right shoulder and wrist. RL can be attached anywhere above the right angle and below the torso. LA can be attached anywhere between the left shoulder and wrist. LL can be attached anywhere above the left angle and below the torso. V1 should be placed in the fourth intercostal space at the right sternal edge. V2 can be placed in the fourth intercostal space at the left sternal edge. V3 should be placed between V2 and V4. V4 should be placed in the fifth intercostal space, that is mid-clavicular line. V5 in the anterior axillary line in straight line with V4. V6 in the mid-axillary line in straight line with V4 and V5. Here you can see the proper placement of ECG leads. V1 can be attached in the fourth intercostal space at the right sternal edge. V2 can be placed in the fourth intercostal space at the left sternal edge. Then attach lead V4 in the fifth intercostal space at the mid-clavicular line. Then attach V3 lead midway between V2 and V4. Attach V5 lead in the anterior axillary line straight line with V4. At last, attach V6 in the mid-axillary line in straight line with V4 and V5. And as I said already, all the limb leads to be attached in the right forearm, left forearm, left lower leg and right lower leg. Here we can see the placement of ECG leads posteriorly. So first we have to take a normal ECG by keeping the leads as I explained before. Then the lead V4, V5 and V6 will be removed and attached posteriorly. The lead V4 will be relabeled as V7. The lead V5 will be relabeled as V8 and the lead V6 will be relabeled as V9. So V7 can be attached in the left posterior axillary line as you can see in the picture. V8 at the tip of left scapula and V9 can be placed in the left paraspinal region. Thank you so much for watching this video. Even though this is a simple topic, most of the times when people ask, we find difficult to explain it in a proper way. So I guess this would be helpful for you guys. If you feel the same, kindly like, share this to your friends and subscribe my channel. My channel name is Jebin Shine and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new video. Thank you all. See you all once again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.